Texas is a leader nationally in terms of promoting routine HIV testing in healthcare settings. Opt-out testing is where the clinician simply informs the patient. As a matter of practice, we do a cholesterol, a HIV test, and a syphilis test on all of our patients. What questions do you have?
How the staff talk about it and how they ask clients about it is, to me, the crucial piece. In the past, people have come in and said, okay, I want gonorrhea and chlamydia testing, or I'm here for a well woman exam. And the staff will say, well, would you like an HIV test today? And when you ask people that, it just seems like automatically the response is, no, I don't think so. What we find is that if you say to people, today we're testing you for gonorrhea, chlamydia, HIV, and syphilis, they'll say, okay, that sounds fine. And it makes a huge difference in the number of people that are testing.
Patients have the right to refuse HIV testing. That's absolute. In Texas, there is no legal requirement for pretest counseling, and in Texas, there is no legal requirement for a separate written consent for an HIV test. The best way to perform the testing and deliver results is the way that fits in with your practice.
Well, it's really to try and use the word routine as pronounced as possible in the presentation to the client.
We consider this a routine test and that we're giving everybody this test.
This is just part of what we do on a routine basis here for every patient that comes through the door.
It's just like getting your cholesterol screened or looking at your blood pressure, all your vital signs. We want to make sure HIV is included with that conversation, so it makes it very normal.
It's a matter of changing the culture within our staff, normalizing it for people, having them be comfortable with asking it.
One thing that I learned early on is the benefit of having a champion. Dr. Skelson Hojai is our champion at Ben Taub. We collaborated on the entire thing, but when we'd meet an obstacle, and we had a few, he would always help us solve that problem, keep it simple.
It has to be in an automatic system. The order is already on the order sheet that's used. It doesn't have to be added to an order. It's already ordered on anyone we're drawing blood on.
Many people are concerned that they don't have the training to do HIV testing or to do the counseling that's associated with it. But we'll be clear about this. There's no special training that's required to do the HIV testing or deliver the results.
The nurses would forget to draw the extra red top. So we put reminders on the nurse's cart. We put reminders at every station where they drew blood to rush that red top, and did you get the extra red top, and all those kind of things, and made it catchy. Where the medical community has had some reservations, that there's still a lot of old notions out there is like, well, what do I do with this patient when I tell them they're positive?
It's not different from telling a patient you have cancer.
Giving positive results, I think, is just a matter of treating people as we would want to be treated if we were given that kind of news.
So talking to a patient, it's basically you have to put it as simple as possible to them to help them understand what it means to have HIV.
And so we spend the time with the clients that they need. We give them the results, give them some time to think about it, and then just let them talk or ask questions or whatever it is that they need to do.
A key part of our program has been connecting those people to care. In fact, that's where most of our resources go, is to have someone give them their results who really knows what they're doing and hold their hand until they get into care.
So we have several agencies that we work with, and when we give a person results, we talk to them about which agency they want to go to.
My goal is always to try to get them to go into care.
We offer the hope that there is hope, and that treatment is out there and it's good.
I let them know it's not like 10, 15 years ago when people told you you're HIV positive. The chances of leading a long, healthy life are much better now.
Folks can live routine, productive, enjoyable lives, being able to create a future for themselves.